Hey guys, so we are here with Destiny, and today we're going to be doing the push-up and curl-up test. So for the push-up test, it's going to measure the muscular endurance for the upper body. So the setup is going to be where the volunteer is going to do the max number of push-ups performed without a rest. So the key is pretty much the test is going to be over when she's now no longer doing the proper technique in the push-up. And then we'll record the amount she does, and then we'll look at the norms file graph, and it'll be able to determine where she's sitting on that graph there. So for women, we start off as a modified position. So hands are going to be hands and knees and feet will be touching the floor. Upper body is going to be in a straight line, knees slightly apart, and then arms are going to be shoulder width apart. So they're going to press the body to an extended position, and then they're going to lower the body down until the chest touches the floor or their elbows hit a 90-degree. So I'm going to go ahead and show you an example. Some of the common faults for this test are the hand placement. So sometimes they'll be too wide or they'll be too narrow. Elbows could flare out, head drops, their lower back tends to drop. They don't go into a full range of motion, they cross their legs, hold their breath, things like that. So we want to make sure we're not doing any of those. So I'm going to go ahead and show you. So we're going to start with knees and feet are going to be on the ground here. Okay. Hands are going to be shoulder width apart, back straight. And you're just going to go into a push up here. And your feet, make sure your feet are here up in the air. So here, don't cross them. And you're gonna go up, and you're gonna go down, and you're gonna go up again. Okay, so the test here is gonna be to do as many as you can. If I do see where your technique is starting to flare up or anything like that, that's when we'll end the test. Okay. So there's no really time limit, it's just how many you can do.
Okay.
Okay, so we're gonna have you go ahead and place your knees, feet on the ground, arms shoulder width apart, make sure your back stays straight. And you don't cross your feet, yes, or don't cross your feet. So, all right, so we're gonna do that, and you're gonna go ahead and go down into a push-up and up, and you're gonna keep going. There is 2, 3, 4, 5, 6, 7, 8. Nice job. 9, 10, making sure she's getting that 90-degree angle there. 11, 12, 13, and her back's still flat there. 14, 15, 16, 17. Nice job. 18, 19, 20.
That's where it ends.
All right. Well, that was still a great job. So 20 was going to be her number. So we'll go ahead and look at the norm and see how that correlates and see what area she is and where her classification is. All right. So the next thing we're going to do is the curl up test. With the curl up test, this helps assess the development of the core muscles, and helps prevent injury and then reduce the lower back pain or improve balance and posture. So the first thing we do to set up is going to place tape on the floor here, and there'll be 12 centimeters from where the client's tips of their fingers are going to lay. So I'm going to give an example, but first we're going to have the client lay supine, so they'll be on their back. Their knees will be 90 degrees with feet on the floor. And then their arms are going to extend out. So their arms will extend out onto the top of the tape there. And then they're gonna lift their shoulder blades up and reach across the 12 centimeters. We need to make sure that their feet remain on the floor, and then they'll do as many as they can until unless they reach 75, then that'll be a cap. Some not do's is they don't reach the full across to the 12 centimeters. Only one hand reaches, or maybe their feet lift off the ground. So I'm going to go ahead and do an example here. So we'll lay on the tape. Tip of the fingertips are going to be on the edge of the tape here. And your feet are going to be 90 degrees, and you're just going to reach and back. Reach and back. Okay. Okay, so I'm gonna have you go ahead and do as many as you can, okay?
Okay.
We'll begin the curl-ups now. Ready? Begin. Up, down,
Make sure
1,
your feet stay on
up,
the ground. And make
down,
sure you don't forget
2,
to breathe, okay?
up,
So exhale.
down,
There
3,
you go.
up, down,
Nice
4,
job.
up, down, 5, up, down, 6, up, down, 7, up, down, 8, up, down, 9, up, down, 10, up,
Okay, so
down,
we're gonna go ahead
11,
and stop the
up.
test there. As you can see, her feet did come up right on the 11th one. And once that occurs, then the test is now complete. So we're gonna go with the number of 10 curl-ups for this assignment. Okay, so right after the 2 tests, we're gonna wanna find her resting heart rate. So we're gonna put a timer for 30 seconds once we find her heartbeat. So we're gonna go here. We found it, so we're gonna hit start and count. Okay, so 40 beats, and then what we're gonna wanna do is we'll times that by 2, and that'll be what her resting heart rate is. Okay, so the next thing and the last thing we're gonna do is check her blood pressure. So I already have this set up here. It is going to be on her brachial artery, so I palpated to locate that, and you'll see how the arrow is going to be pointing towards it. The next thing is I'm gonna put these on here. We're gonna make sure we place this right where the brachial artery is, and we're gonna use 2 fingers to press down on it, okay? And then we'll start pumping until we hit about 180, and then we're gonna slowly release it a little bit. Okay, so it's about 125/78.